Union Health Minister JP Nadda today informed the Parliament about the National Health Policy, which was approved by the Cabinet yesterday. The policy was in the making for 15 years and it has finally now seen the light of day. Archana Shukla, who tracks that story very closely, is here with the details. Archana, take us to the fine print.
Well, yes, a much-awaited policy on the healthcare front by the government. Three things, the three core areas that the government wants to touch upon through the National Health Policy is increase spending, improve primary care and push for affordable care. How they are planning to do it? The biggest, a push will be from increased spending on public health care by the government. Right now, they're spending only 1.2% of the GDP. They intend to increase it to 2.5% in a phased manner. This is not happening on a one-to-one basis. The other bit is on the primary healthcare push, where they're saying that of what the government will be spending, more than 66% increase in allocation for primary healthcare. They're saying they're aiming to come to 2 beds per 1,000 population in a phased manner. Right now, it stands at 0.9 beds per 1,000 population. And they're saying that they would issue health card to all families in India. What will become free in public hospitals will be medicines, diagnostic, emergency care, as well as all healthcare facilities, but only in public hospitals. They're also looking to involve the private sector in trying to achieve the national health goals that they have put forth. And they're also talking about, improving the healthcare delivery, talking about hospitals and how to regulate hospitals and medical devices. They're also pushing for bringing the cost of healthcare on the drugs and medical devices side by pushing for local manufacturing of those products under Make in India. Let's talk of the key targets that they have put forth. Life expectancy, their goal is by 2025 to come up to 70 years in India. Total fertility rate, they want to bring down to 2.1. As far as under 5 mortality rate is concerned, the goal is to bring it more than half, down to 23 deaths under 5. As far as maternal mortality is concerned, the goal is to bring it to down to 100 deaths per 100,000 women, and the infant mortality to bring down to 28. These are some of the key targets which should be watched out for, and the fine print on how they intend to achieve this will be most awaited.
The policy is aimed at reaching healthcare in an assured manner to all, particularly to the undeserved, to the underserved and the underprivileged. As a crucial component, the policy proposes raising public health expenditure to 2.5% of the GDP in a time-bound manner. This is a shift from the old policy. We are making it patient-centric. Now we will develop the standards. What is the protocol, how the treatment has to be done, and if the treatment is not done accordingly, the tribunals will be set up to take care and the patient will get redressal from that.